Okay, please, sir.
Okay, so here we will demonstrate how to set up a transcutaneous spacing models for the instructors. To set up a transcutaneous spacing model station, we need a simulator mannequins, what you are seeing here. We need a gadget which is capable of pacing, and we need a sim monitors, laptop, and a sim pad to do the settings for training the students. Initially, the instructor need to show a bradycardia algorithm which may require transcutaneous pacing. The scenario has to be created by the instructor and student need to perform. So here I have shown a bradycardia scenario which is a case of sinus bradycardia, and the student need to be first told how to approach a case of sinus bradycardia with the pharmacological maneuver, and once the pharmacological maneuver fails, the second line of treatment is transcutaneous pacing. At that point of time, one student need to be called and they should be asked to demonstrate how they initiate a transcutaneous pacing. To initiate a transcutaneous pacing, the student should first take to talk to the patient if patient is conscious, and take appropriate consent and consider keeping sedation, analgesia and crash cart before initiating transcutaneous pacing. Then the student need to take out the cables or pacing cables from the cover. It will look something like this. I have just taken out from this cover the pacing cables. Then the student need to identify by looking at the picture which pacing cable has to be attached to which part of the chest. Once the pacing cable is attached, by detaching it from the seat, then the instructor should see that it is applied firmly on the chest surface without any loose gap between the skin and the pacing cables, and it should be also ensured that it is not placed over any bone surface. Once pacing cable is placed on the patient bare chest, the next thing that the student is expected to do is to connect the other end of the pacing cables to the pacing monitor. Once the cable is connected to the pacing monitor, the next thing that the student is expected to do is to set the pacing rate. If you look at the pacing monitor, it need to be changed into the pacing mode, what you can see in the green. Once you set the pacing mode, you will see that the machine is now ready to pace. Here you see two things. One is the output current, which can be controlled by the output knob on the my left side, the knob. The basic default setting is 30 pulse per minute. So this is the basic default settings. This can be controlled by the pacing rate on the right side of these machines. So the minimum rate that need to be kept as a pacing rate is our normal heart rate. So the student first need to change the pacing rate. So here I am changing the pacing rate to what is our normal heart rate is around 70. So I will put it at 70. Then the student can see that he is not seeing any pacing impulse. The student need to be asked why there is no pacing impulse. Then the student need to answer that I have to start pacing the patients by increasing the current output. So the student again need to be asked, okay, let us increase the current output. So once the current output is increased by controlling this knob, so the student should be told that usually we should start moving the knob slowly from 20 milliampere onward, and the student should do it in a succession of 5 milliampere, then looking at the monitor for 5 seconds. In the meantime, the instructor should be ready with the sim pad to change it to a different rhythm. So once the students keeps increasing 20 to 25 or 25 to 30 in succession of 5 milliampere and looking at the monitor every 5 seconds at a appropriate output strength, the instructor should change the rhythm to PM lock, which is there in the sim pad. You can see there is something what is called the PM lock in the sim pad. What instructor should press the PM lock, activate it, rate increase to the set pacing rate, that is around 70, and activate it. Now the student should be asked to look at the monitor and they are supposed to be asked what are the different things they are seeing on the monitor screen. The student should be able to identify the native QRS complex of the heart, which is a very narrow QRS complex. The student should identify the broad QRS complex next to the pacing spike, and at the same time, the student also should identify the normal pacing spike, which is not followed by a QRS complex. This is the just pacing spike, which is not captured by a QRS complex. Then the student should be asked what we should do so that each pacing spike should be converted into a wider QRS complex, or that what we call as a electrical capture of the patient, electrical capture of the pacing spike. Then the student should answer that we will again increase the output strength. Then again the student should be asked to manipulate the current output. The student should follow the similar lines by increasing 5 milliampere and looking at the monitor screen if it is changing or not. After 2-3 changes here at 40 to 45, then 45 to 50, the instructor should ready to change the rhythm again to a complete electrical capture. This can be seen from the pacemaker symbol on this gadget. So this need to be activated again. So once it is activated, the student should be asked whether they are able to see any changes in the pacing spike. So once the SIM-pad is configured to this pacing rate, then the student should be asked, then the student should be able to identify that here now each pacing spike is converted into a electrical capture. We don't see any alone pacing spike. So here the student should be asked, can you tell me what is your pacing threshold and at what current there is a change into complete electrical capture? Then the student should be able to identify, yes, at 40 I got the pacing threshold. That means I was able to see that I'm able to send current to the heart, but the heart is not capturing all the current stimulus what I'm giving to heart. But once I increase from 40 to 50 milliampere, now all the stimulus what I'm giving to the heart is being captured. This is what is considered as a electrical capture of the pacing spike. The next thing student should be asked is it the end of the scenario or do you want to check something else? Then the student should be re-emphasized that the question is not only changing the pacing spike to electrical spike, the patient should be clinically well, for which the patient has come to us and we started transcutaneous pacing. How we are going to do that? Then the student should answer that I will check the vitals. While checking the vitals, the student should be asked what you are going to check. Then the student should say that I will checking the peripheral pulse, that whether this complete electrical capture is getting transmitted into a peripheral pulse or not. At the same time, the student should be re-emphasized that they are not supposed to check the carotid pulse because this electrical stimulus may transfer into neck muscle and may cause a false impetus carotid pulse. The student should be told that we should go for a peripheral pulse like femoral pulse and brachial pulse. Then the student should be asked what is the importance of checking the peripheral pulse. Then the student should be able to answer that at the end we should confirm that the number of pacing spike what we are giving to the heart is converted into complete electrical capture and the same number of electrical capture is producing an effective contraction to result a peripheral pulse. So then the student should be asked what is the next step you are going to do. Then the student should be able to answer, I got my pacing threshold at 40 milliampere current, I got electrical capture at 50 milliampere current. Now at the same 50 milliampere currents, I am also getting a complete mechanical capture of the electrical capture. So what I should do next is I will increase the current output by 10% more than the electrical current at which I got the mechanical capture, so that any change in impedance of the chest wall will be taken care by that. Then the student should be asked how we are going to change it. Then the student should again go to the control knob for increasing the output and increase it by another 10%, that is 55 milliampere. So at this point the session ends and the discussion can be further continued. What are the different causes of increased chest wall impedance and how we are going to do that? What mode of this transcutaneous pacing is, what you are expecting in the cath lab to be done, or what could be the cause of this bradycardia. And at this point the student should be asked to again memorize the mnemonics, hit the target to find out what could have been the probable cause of bradycardia and institute appropriate treatment. This finishes the session of transcutaneous pacing model setting and demonstration. Thank you.
So to confirm the mechanical capture, where he has to palpate?
The student is expected to palpate a peripheral pulse like femoral pulse or brachial pulse.
Okay, after palpating the femoral pulse only.
After palpating the femoral pulse, student should confirm the number of pacing rate, what is set, the electrical capture, what is being shown on the monitor, and the pulse, what is felt on the femoral artery, all are a same number. Then we can say that everything is in coherence.
Okay, thank you, sir.
Thank you.